Esthetician Review Writing Exam. Anatomy. Please like and subscribe. Anatomy is the study of the organs and systems of the body. Cells are the basic unit of life. The basic structure of a cell consists of a nucleus, cytoplasm, and the cell membrane. The nucleus is the control center of the cell activities. Cytoplasm is the production department of the cell. Human cells reproduce by a process referred to as mitosis. Metabolism is the chemical process by which cells receive nutrients from the cell growth and reproduction. Anabolism is the process of building up larger molecules from smaller ones. Catabolism causes a release of energy within the cell. Tissues are groups of cells of the same kind. Nerve tissue carries messages to and from the brain and coordinates body function. The skin, brain, and stomach are all organs of the body. The hands are not an organs of the body. When stimulated, muscular tissue contracts to produce motion. Organs are separate body structures that perform specific functions. A system is a group of body organs that perform one or more vital functions of the body. Nerves, digestive and circulatory are all body systems. The skeletal system is the physical foundation of the body. Osteology is the study of bones. Flat bones are plate-shaped bones located in the skull, hip bone, sternum, ribs, and, according to some, are patella. The skull is the facial skeleton that encloses and protects the brain and primary sensory organs. The frontal bone extends from the top of the layers to the top of the head to form the forehead. The parietal bones form the crown and upper side of the head. 9 of the 14 bones that compose the facial skeleton are involved in facial massage. The mandible is the lower jaw and the largest bone of the facial skeleton. The cervical vertebrae are the 7 bones that form the top part of the spinal column. The spine, sternum, and 12 ribs make up the thorax. Phalanges are the 14 bones that form the fingers. Levator is the term used to describe a muscles that lift up. Cardiac, skeletal voluntary, and smooth involuntary are all types of muscle tissue. Voluntary muscles respond to conscious commands. Non-striated muscles automatically to control various body functions. The 3 parts of the muscles are the origin, belly, and insertion. Tendons are bands of fibrous tissue that attach the muscles to the bones. Muscles affected by massage are generally manipulated from the insertion to the origin. The epicranius is a broad muscle that covers the scalp. The occipital is the muscles located at the back of the neck and draw the scalp back. The procerus draws brow down and wrinkles the area across the bridge of the nose. The zygomaticus draws the mouth up and back as in laughing or smiling. The buccinator is responsible for compressing the cheek to release air outwardly, as in blowing. The mastication muscle that is located above and in front of the ear and performs both opening and closing of the jaw is the temporalis. The sternocleidomastoid causes the head to move from side to side and up and down. The supinator turns the palm of the hand up. The flexor ulnaris is located mid-forearm and bends the wrist and closes the fingers. The abductor muscles separate the fingers. Opponent's muscles close the thumb to move toward the fingers, giving the ability to grasp or make a fist. The circulatory system controls the circulation of blood and lymph through the body. The heart, arteries, veins, and capillaries are all a part of the cardiovascular system. The heart is entirely encased in a membrane called the pericardium. The lower chambers of the heart consist of the right ventricle and left ventricle. The average resting heart rate is 60 to 100 beats per minute. Blood is transported through veins, arteries, and capillaries. White blood cells fight bacteria and other foreign substances and increase in number when infection invades the body. The process of coagulation is started by thrombocytes. Plasma is the fluid part of the blood in which red and white blood cells and blood platelets are suspended. Arteries carry oxygenated blood away from the heart through the body. Systemic circulation is the process of blood traveling from the heart throughout the body and back to the heart. The common carotid arteries supply blood to the head, face, and neck. The internal carotid artery supplies blood to the brain, eyes, and forehead. All blood from the head, face, and neck returned through the internal jugular and external jugular veins. Wearing support hose and the correctly sized shoes can prevent varicose vein. The external maxillary supplies the lower portion of the face with blood. Lymph nodes acts as barrier to infections from one part of the body to another. The nervous system coordinates and controls the overall operation of the human body by responding to both internal and external stimuli. The brain controls all three subsystems of the nervous system. The medulla oblongata is considered the most vital part of the brain, containing centers and control breathing and heart function. Primary components of the nervous systems include the brain, spinal cord, and nerves. The central nervous system is composed of the brain and spinal cord. The peripheral nerve systems carry sensory information to the brain by the ears, eyes, nose, and tongue. The automatic nervous system is responsible for all involuntary body functions. The parasympathetic nervous system is the subsystems of the automatic system which slow the heart rate, dilates blood vessels, and lowers blood pressure. Homeostasis describes the body's state of balance. Axons are long, thread-like fibers that extend from nerve cells. Nerve terminals are responsible for sending messages in the form of electrical nerve impulses. The interaction of sensory and motor nerves is called a reflex action. Motor, sensory, and sensory-motor are all types of nerves. Motor nerves carry messages from the brain to the muscles and cause a muscle to react. Mixed nerves perform both sensory and motor functions. Receptors are nerve cells that react to outside stimulation by sending a sensory message to the brain. The 11 cranial nerves that control the motion of the neck muscles is the accessory nerves. The trifacial nerve is the chief sensory nerve of the face, responsible for transmitting facial sensation to the brain and controlling the muscles' movements of chewing. The trifacial nerve controls sensation of the face, teeth, and tongue. Three main branches of the trifacial nerve are maxillary, ophthalmic, and mandibular. The main nerve branch to the top one-third of the face is the ophthalmic branch. The zygomatic nerve extends to the side of the forehead, temple, and upper part of the cheek. The auriculotemporal nerve extends to the ear and to the area from the top of the head to the temple. The seventh cranial nerve and primary motor nerve of the face is the facial nerve. The cervical branch of the facial nerve extends to the muscles of the side of the neck. The temporal branch extends to the muscles of the temple, the side of the forehead, the eyebrow, eyelid, and upper cheek. The radial nerve extends down the thumb side of the arm into the back of the hand. The digestive system breaks food down into simpler chemical compounds that can be easily absorbed by cell or eliminated from the body as waste. The stomach, pharynx, and esophagus are all parts of the digestive system. Enzymes are secreted by salivary glands to break down food. The excretory system eliminates solid, liquid, and gaseous waste products from the body. The skin, liver, and kidneys are all organs of the excretory system. The skin is the body's largest organ. The liver converts and neutralizes ammonia from the circulatory system to urea. The lower respiratory tract consists of the lungs, trachea, and bronchi. The endocrine system is a carefully balanced mechanism that directly affects hair growth, skin conditions, and energy levels. The skin and its layers make up the integumentary system. The two primary glands of the integumentary system are the sebaceous and sudoriferous. Thank you. Please like and don't forget to subscribe.